afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Acting Mayor of the City of London, Josh Morgan, as well as the Medical Officer of Health at the Middlesex London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Zucolo. And a welcome to the members of the media who are in attendance this afternoon. We're glad to have you here. And just a quick reminder that if you do have questions for either Dr. Zucolo, Dr. Summers, or Acting Mayor Morgan, you can get those into this afternoon's briefing. All you need to do is click on the question and answer icon here on Microsoft Teams. That's the question mark inside the text bubble at the top of the screen. And when you do submit those questions, if you could indicate your name as well as your media outlet and who your question is for. And it's a good idea not to wait to get those questions in. So do use that opportunity this afternoon. And finally, would also like to welcome the folks who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are watching on the CTV London website. Well, let's get to our opening remarks right away. And we'll start this afternoon with Acting Mayor Josh Morgan.
Well, good afternoon, and thanks, Dan. I'd like to start by wishing a very joyous Eid Mubarak to all of those celebrating here in London and around the world. It's my sincere wish that this day brings peace, happiness, and good health to you and your loved ones. I'd also like to use this opportunity to highlight that today also marks the official launch of Emergency Preparedness Week. Of course, having navigated the last 2+ years of COVID-19, we've learned how critical it is to be prepared for all types of emergencies. We have also come to understand and appreciate the important work that our frontline workers and first responders do to keep our city safe. Thank you to all of the staff who are continuing to support our residents and who have not only stood by us through this pandemic, but also helped us navigate the other challenges and emergencies our community has faced. One of the themes of this year's campaign is to encourage Londoners to better prepare themselves and their families during emergencies. We each have a role to play to reduce the risks we face during an emergency. Learn what those risks are, understand how to prepare for them, and make plans to keep ourselves, our families, and our communities safe. Above all, and especially during these times, we need to remember that emergency preparedness is certainly a shared responsibility. And once again, thank you to all of the first responders who have not only supported us through COVID-19, but also through the multiple emergency management challenges we've had over the past couple of years. Your work is so appreciated, and we can't thank you enough. That's all I have, though, for today, so I'll turn it over to Dr. Summers.
Thank you, Acting Mayor Morgan, and good afternoon, everyone. Eid Mubarak. Many people in our community have been celebrating Eid al-Fitr over the weekend and today to mark the breaking of the fast that ends the holy month of Ramadan. On behalf of the Middlesex London Health Unit, I'd like to wish everyone in our organization and across our community Eid Mubarak. May peace, good health, and blessings abound this year and always. The Middlesex London Health Unit is reporting an additional 43 COVID-19 cases and no additional deaths today. Over the weekend, a total of 130 additional COVID cases and 1 additional death were reported. On Saturday, 86 cases were reported and 1 COVID-related death. That death occurred in an individual in their 70s who had received 3 doses of the vaccine. 44 cases were reported on Sunday. We now have over 37,000 COVID cases in the London and Middlesex regions, have been reported since the beginning of the pandemic. The number of COVID-19 related deaths now stands at 376. Vaccination continues to be a critical intervention in protecting yourself, your family, and your friends from COVID-19. We are pleased to announce the return of the GoVax bus mobile clinic to our region this week, as it makes 7 stops in London and Middlesex County in May. It will visit, firstly, the Lucan Community Memorial Centre this Thursday, before making a stop at London's Sherwood Forest Mall the next day on Friday. The clinic provides first, second, and booster doses to those who are eligible in order to reach those who may not be able to reach the vaccine in other areas. Throughout the month of May, the COVAX Clinic will also visit the Kiwanis Seniors Community Centre on Riverside Drive in London, Northland Mall on Highbury Avenue in London, Westmount Shopping Mall on Wonderland Road South in London, and the Shops on Sydenham on Front Street in Strathroy, as well as Pond Mills Square on Commissioners Roads East in London. Please make sure that you come and visit those clinics. If you have the opportunity to do so, you can check out the schedule on our website. You don't need an appointment. Walk-ins are certainly welcome. In addition to the GoVax Bus, there are many other ways to get vaccinated, including at our mass vaccination clinics at the Western Fair Agriplex and Caradoc Community Center in Mount Bridges. The clinic at White Oaks Mall also continues Thursdays to Saturdays from 1 to 7 p.m. In addition to our COVID-19 vaccination, we are also starting to run school-aged immunization catch-up clinics at our mass vaccination clinics, and that starts this week. The purpose of these clinics are to provide opportunities for school-aged children to get caught up on any of the required vaccines that they might have missed throughout the pandemic. In recent weeks, the health unit sent about 17,000 letters to high school-aged children who were due for immunizations that are required under the Immunization of School Pupils Act. If you or your household received a letter from the health unit, but you've already received the vaccines that you have listed to be missing, we would kindly ask that you submit your record to the health unit online at www.healthunit.com/immunization-records. In that way, we can make sure you're up to date. And of course, if you're not, make sure you book an appointment as soon as you can. We continue to see COVID circulate in our community as we enter the month of May, but there are signs that things are improving. It still remains critical, however, that we take steps to protect ourselves. And as a health unit, we continue to strongly recommend that you wear a mask in all public indoor settings. Make sure you're up to date with your COVID-19 vaccine. If you're over the age of 12, get a booster. If you're over the age of 60 and it's been 5 months since your third dose, get that fourth dose booster as soon as you can. If you are unwell, stay at home and monitor yourself for symptoms of COVID-19. And if you test positive, make sure you stay at home for at least 5 days, only to leave isolation if your symptoms have been improving for 24 hours. It's critical that we continue to take COVID seriously. It's not over yet. And although we are seeing those encouraging signs, it's important to still take those steps to protect yourself. Thanks as always for joining us on this Monday afternoon. And I'm going to hand things over to Dr. Ducalo from London Health Sciences Centre.
Thank you, Dan, Acting Mayor Morgan, and Dr. Summers for having me here to share an update about the COVID-19 situation at London Health Sciences Centre. I'd like to start by amplifying my colleagues' Eid Mubarak wishes expressed earlier on this call for our staff, physicians, and community. As of this morning, we're caring for 48 COVID-19 positive inpatients, and we have 5 or fewer patients in critical care. In our children's hospital, there are 5 or fewer inpatients with COVID-19. We currently have 2 active COVID-19 outbreaks. Overall, we are pleased to report that the number of patients we are seeing seems to be on the downward trend. It appears that we may have now passed the peak of this 6th wave. With that said, we know from past experience that this does not mean we can relax on safety measures, as COVID is still very much prevalent in our community, as mentioned by Dr. Summers. We ask the public to support our continued masking and vaccine requirements within our hospitals and to continue to practice social distancing and masking outside the hospital. Finally, I would like to take this opportunity to inform the public that as of yesterday, the Carling Heights Assessment Center is only booking appointments by phone. If you require an assessment, fall within the provincial guidelines for a PCR test, or requiring testing to travel, please call to book an appointment. More information on eligibility and the number to call can be found on our website. Thank you, and I look forward to your questions.
Thank you very much, Dr. Ducalo, Dr. Summers, and Acting Mayor Morgan. We do have some questions in the queue, and again, a reminder for the members of the media joining us this afternoon. If you do have a question, don't hesitate to ask it. Just click on the Q&A icon here at the top of your screen on Microsoft Teams. That's the question mark inside the text bubble. And when you do submit your question, if you could indicate your name as well as your media outlet and who your question is for. Well, let's get to those questions right away. The first question this afternoon, Dr. Ducalo, is for you. It comes to us from Sawyer Bogdan at Global News Radio 980 CFPL. Dr. Ducalo, can you give us an idea of how things at LHSC are going in terms of COVID-19 cases this week when compared to last week?
It's a great question, Sawyer. Thank you. So our staff numbers have trended down, thankfully, over the course of the weekend. And similarly, as I mentioned in my preamble speaking, that the number of inpatients also seems to be trending down. We're still at 49 and our peak was close to 60 in this wave. So we're hoping to see that trend continue for another 1 to 2 weeks before we can be confident that we're out of or past the peak of the sixth wave.
Thank you very much. Let's go to the next question. This one is for Dr. Summers, and it comes to us from Sophia Rodriguez at CBC London. Dr. Summers, what has uptake been like for fourth doses? Do you expect eligibility to keep expanding to other age groups for fourth doses?
Thanks for that question, Sophia. Fourth dose uptake has been fairly good. Certainly every time we've seen an additional booster dose become eligible, uptake has been slower than what we would have previously seen. If you go on our dashboard, we do provide our coverage based off of fourth dosing under the vaccination coverage tab. For those 80 and above, 26.9% of all 80-year-olds and above in the Middlesex London region have received a fourth dose. In contrast, if you go to those 65 to 69, 14.5% have received a fourth dose booster. So we do see a range of uptake, and certainly it's not as high as the booster dose uptake was for the third dose. But with a disclaimer, many people are waiting to the 5-month interval in order to get their booster dose, and not everybody has hit that 5-month interval yet. So we will continue to see fourth dose coverage improve, I think, throughout the month of May and into June for those that are 60 and above. If you are at that 5-month interval and you're 60 and above, I would recommend that you get your booster dose, that second booster dose, as it will give you some protection against both infection, symptomatic illness, and of course severe outcomes, while we still see a lot of COVID circulating in our community. We've also had some people wonder whether or not they should wait to get a fourth dose for an Omicron specific or modified vaccine this fall or late summer. And my recommendation would be to not wait. By the time those additional vaccines maybe become available, you'll likely be eligible for a fifth dose at that point. So don't wait, just go and get your booster if you are eligible. Sophia, you also asked whether or not we expect eligibility to keep expanding to other age groups for the fourth dose. Not sure. It's not as clear at this time what the additional benefit of that fourth dose would be for those under the age of 60 who otherwise have no other medical comorbidities. Growing evidence, I think, will suggest that immunity wanes over time, even for those under 60 from a third dose. And so that additional booster at some interval will be required to avoid infection, symptomatic illness, and potentially severe outcomes. We know that our colleagues at the National Advisory Committee on Immunization continue to look at this emerging data, but I don't readily anticipate the expansion of age groups within the next few weeks.
Thank you very much, Dr. Summers, and thank you for the question, Sophia. And for the members of the media in attendance this afternoon, also for the folks tuning in, the vaccination coverage data is updated on the Health Unit's dashboard every Tuesday. So those numbers, again, that Dr. Summers was mentioning will be updated tomorrow. So I do encourage you that if you're interested to find out what those numbers are and whether the coverage has changed week to week, you can visit healthunit.com. Click on the COVID-19 info link and you will find the link to the local data dashboard, and all the information is there. Well, let's go to our next question. And the next question is from Sawyer Bogdan again, and this is for Dr. Ducalo. Sawyer again joining us from Global News Radio 980 CFPL. Dr. Ducalo, there are 2 outbreaks at LHSC hospitals. Can you elaborate more on which units these outbreaks are in and how many people are impacted? Also, what is the situation like at Children's Hospital? Are you seeing more cases related to children?
Thank you very much, Dan and Sawyer. I'm going to start with actually correcting a comment I made in my preamble. I mentioned travel testing at the Carling Assessment Center, and we don't test for travel except for very specific scenarios. So you're best to go to a travel clinic or a pharmacy for that type of testing. But on to your question, Sawyer, apologies for the interlude. So as I mentioned, we have 2 outbreaks. One is at University Hospital on the 4th floor medicine units, and the other is at Victoria Hospital on the 6th floor subacute medicine units. The Victoria Hospital outbreak involves 6 patients and 6 staff. The UH1 involves less than 5 patients and less than 5 staff. As for Children's Hospital, another great question. We are seeing many cases in our emergency department and are aware of many in the community, but thankfully the number of admissions has slowly declined in the past week. So we continue to be ready to receive patients should we need to, but are once again hoping that we pass the peak of this 6th wave in the hospital, both for adult and children patient populations.
Thank you very much, Dr. Duclos. And that does bring us down to our last question that is currently in the queue. And a reminder for the members of the media, if you've been waiting, now would be the time to get that question in. I know there's a little bit of a delay between when we are producing and when you hear what we're saying. So there you go. Final warning if you have any questions that you'd still like to get in this afternoon. The last question right now is from Sophia Rodriguez, again from CBC London, for Dr. Summers. Dr. Summers, with the weather getting nicer, how would you advise Londoners to proceed when it comes to masking and avoiding big crowds? Do you believe the worst of the 6th wave is past us at this point?
Thanks for that question, Sophia. I do think that we have hit the peak of the 6th wave and are on the decline. But I qualify that statement by saying there's still a lot of COVID out there. And as you will attest from probably many of your family and friends or even yourselves, we are all being touched by the COVID infection as we speak. So despite the fact that we are peaking, there is still a lot of COVID around. And that's, I think, critical for people to understand with regards to the steps that they can take to protect themselves and their family and friends. In terms of the guidance to Londoners when it comes to masking and avoiding big crowds, I think it's essential that people wear masks in indoor public settings if they are wanting to reduce their risk. It's a really helpful, simple, and effective tool to reduce your risk of exposure. Making sure you're up to date with your vaccinations remains critical. In terms of going to indoor crowds, being at events with large indoor crowds, I think we need to acknowledge that there is likely somebody in that crowd who is incubating or transmitting COVID-19 at that time. You have to know that that is happening. The risk is notably mitigated if you're outdoors. Have events outdoors. It is very effective at mitigating the risk of transmission. So again, I would say to Londoners and to those Middlesex County residents that there are tools in your toolbox that you can use to reduce your risk, even as we see lots of transmission that is out there. But you're never going to reduce your risk to zero unless you stay at home and don't leave the house. So if you're going out, you know that by masking, you reduce your risk. By having your vaccination status up to date, you're reducing your risk. By spending time outdoors, you're reducing your risk. Those are tools in your toolbox that can help reduce your risk. By going into a large indoor gathering, you are taking on some risk. And that, I think, is important for people to understand still as we have lots of COVID activity in the community.
Thank you very much, Dr. Summers, and Sophia, thank you also for that question. Well, that does bring us to the end of our questions for this afternoon's briefing. We thank you very much for the time and for spending some time with us. And as always, a big thank you to London Acting Mayor Josh Morgan, to Dr. Alex Summers from the Middlesex London Health Unit, and Dr. Adam Duclos from London Health Sciences Centre. Thank you all for your insights and your information this afternoon. That will do it for us for today. We'll be back with our next virtual media briefing next Monday afternoon. That will be the 9th of May at 2 p.m. We hope you'll join us then. So between now and next Monday afternoon, have a great rest of your day. Have a great rest of the week. And so long for now.